welcome back to another edition of the Friday Show, sponsored this week by Uptowncharlybrown Stud, standing at Diamond Bee Farms in Pennsylvania. And they've got some exclusive memberships in the Uptowncharlybrown Stud Racing Partnership. Starts at $1,000 in the lucrative Pennsylvania program. Really pleased to be joined today by Dr. Kate Papp and by our editor-in-chief, Natalie Voss. Dr. Papp, welcome to the Friday Show.
Thank you for having me.
You know, this is going to be kind of a true confession, but the first time we met was at a congressional hearing in Pennsylvania. You testified saying that at the time vets were going into horses' stalls with 5 or 6 syringes, injecting horses on race day with all sorts of things that were not permitted. And I just frankly couldn't believe it. And I wrote that. A few years later, that turned out to be true, as testified in federal court in Pennsylvania. And at the time, I think you said to me, "Why are you such a dick?"
Yeah, you said, why did anybody even invite her to say any of those things? That's not true. Yeah, so that's why I said that. But well, guess who got the last laugh?
You got the last laugh, and I'm not afraid to admit that I was absolutely wrong.
Sadly.
So there's been a lot going on, obviously, with betamethasone, with Medina Spirit, the Derby winner who tested positive for that drug, allegedly. And that's why you're here to talk a little bit about that. So the first question I have for you about this, as a racetrack practitioner who, by the way, also has an aftercare program, you can check it out at paracehorse.org, rescue, rehabilitation, all sorts of things. Thank you for doing that, Dr. Papp. What are the different uses of betamethasone, both the injectable form and the ointment?
Actually, there's probably a zillion types of forms that comes in a foam, an ointment, topical, systemic, where you can inject into a muscle under the skin. I mean, there's probably something oral that contains it. Actually, I think we heard about a cough syrup or something similar, and then injectable form. Working with small animals in my free time, and also with the racehorses, I find I use it differently in both situations. So betamethasone is a component of a lot of generic topicals. So when there is a fungus, which a lot of racehorses can get, or not even a fungus, a bacteria, irritation, reaction from chemicals in the skin, the bathing soap, whatever, there is usually a triple combination of a generic or a named substance that has an antibiotic, an anti-fungal, and also an anti-inflammatory. And these are steroidal anti-inflammatories. Betamethasone is in a few of them. There's something called Beta-Gen. So that's a spray. And it has genticin, which is an antibiotic, betamethasone, and another antifungal, probably clotrimazole. And so the idea is whatever's causing the inflammation, whether the horse cut himself and got a little bit of bacteria or fungus from the straw in the stall, that you'll also make the swelling go down at the same time while using antimicrobials. So that's the topical use. Most often we see these combinations used in small animals, frequently for hot spots. Hot spots are like probably the number one thing we see these topicals used for in small animals. I guess some veterinarians use the small animal versions like Automax or other products that are labeled for small animals in horses, even though there's other versions. And then what I'm most familiar with working on the racehorses is the injectable form, and that's how most of our regulations are written regarding the injectable form. And there is an FDA-approved product called BetaVet, currently made by American Regent, and it has betamethasone, 2 components, sodium phosphate and acetate. One is a quicker acting, and the other portion is a little bit of a longer acting, and it's usually injected, or at least it's licensed to be, and I've personally only used it into horses' joints for inflammation.
For inflammation, okay. And all of these different versions of betamethasone are all necessarily prescription, or are they over the counter?
All of them are prescription, except for maybe a cough medicine I don't know about.
Okay.
So, Dr. Papp, obviously, as you touched on, the explanation from Bob Baffert's team at this point for the presence of betamethasone in Medina Spirit is that he used a topical treatment called Automax that's usually used in dogs to treat some dermatitis. What can you tell us about what somebody would see looking at the box or the tube of Automax?
Actually, had you let me know, I have a few bottles right next door in the other room.
Shoot.
But no, it's pretty distinct because Otamax is a brand name of a product and it's pretty well known in small animals. Odo for ears and Max meaning maximum, whatever. So it has on the box, it comes in a box, and then inside the box is a tube, and it only comes in certain sizes. The maximum size is probably about the size of even smaller than toothpaste. And it comes with a little tip that you can screw on that fits perfectly in the ear canal of the dog. So what they would see is the ingredients, the name, the manufacturer, and the instructions. And when prescribed by a veterinarian, it would also have a label that comes from that particular clinic.
So it would be clear betamethasone is an ingredient if you're looking at either the box or the tube then.
All active ingredients are very well labeled on the front and the back.
Gotcha.
One of the things that I noticed is that on the instructions, I think it said using more than 7 days may actually cause problems. Is that
correct? That's exactly what it says.
Okay. And according to, I think, Bob Baffert's statement, they started giving it after the Santa Anita Derby, which was in early April, and they gave it up until the day before the Kentucky Derby, which was April 30th. That seems to run contrary to what the warning said on the label or on the box.
Correct. And again, the label's for dogs, so we don't really know what the labeled instructions would be. This product was obviously being used off-label, so veterinarians do have the discretion to give differing instructions for the mode of using things and timelines, so on and so forth, based on knowing the horse, knowing the condition, and knowing the response to treatment or lack thereof.
So no matter how this betamethasone got into the post-race sample of Medina Spirit, a lot of people are saying, well, 21 picograms, that's a trillionth of a gram. That's such an insignificant amount. Why do they test for picograms? And I saw something you posted on Twitter the other day about how 1 picogram of a steroid or something could make a big change in your performance. And I don't know exactly what you meant by that, but could you explain a little bit about what picograms are and why they test for an amount that small?
Sure. So a picogram, I believe, is a quadrillionth of a gram. And if you want to think of a gram, you think of a gram scale that you measure food on. We measure horses in kilograms. So your average horse is approximately, thoroughbreds are about 450 to 500 kilograms, which is about, then you break that down to grams. We give bute in amount of grams, which is an NSAID. So we test in the amount of nanograms. But these aren't nanograms per horse. It's nanograms per mil, because we know if we give 2 grams of bute to a horse, which is half of the daily allowed dose, that they have been studied to show how many nanograms per mil will be effective in their blood. So picograms, because when we're using betamethasone, it's about a zillion times more potent as an anti-inflammatory than bute, because it's a steroidal anti-inflammatory, basically a mimicker of cortisone that's naturally occurring in the body. When we use that and put it into the body, if we're only putting 9 milligrams, which is the maximum allowed dose, then by the time the body metabolizes milligrams, 9 of them, it goes through the liver, goes through the kidneys, and then also into the tissues besides. And some of it resides in the synovial cavity as well. So when it actually is voided, the picogram level, picogram per milliliter of blood, it's not like we take all of the blood from the horse and know how many picograms in the total horse, there's about 50,000 milliliters of blood in the horse. So it's the amount of picograms per milliliter. And so the idea there is they've done studies showing if you inject a horse with Betavet in one joint, 9 milligrams, within 7 days, those horses will show zero signs of having any of the drug in their urine or in their blood. If you were to test them at 3 days out, they may have nanograms or picogram levels, okay? But they also show at the same 7 days out, when you can no longer detect it in blood and urine, you can, if you knew which joint was injected, they took synovial samples and found that the drug lasts much longer inside the synovial cavity, exerting its effect. And then the efficacy on the label shows and states through FDA studies that the effectiveness of taking sore horses and making them sound due to the anti-inflammatory effect can last up to 60 days. So when I say about myself, people get their knees injected all the time, right? Runners, football players, they get their shoulders injected. We hear about these things all the time. And if I know lots of people are like, oh, I had water on my knee. I tore my meniscus. I got an injection, or their back, they hurt their back. They get their discs injected, and they're only being injected with milligrams of a medication, except for these people aren't going back and forth getting their shoulders and knees and backs injected every other week. That usually lasts for a significant period of time for most people. Therefore, that shows they have no drug in their system for many months while they're still having the advantage of improved comfort and performance, whether they're an athlete or just an average person.
I can speak from personal experience, having had 2 corticosteroid injections for something called trigger finger, and it's like a medical drug. Yeah. So.
Hit number 500 is an Uptown Charlie Brown filly selling Tuesday, May 18th at the Fasig-Tipton Midlantic 2-year-olds and training sale. This filly is out of the winning Lemon Drop Kid mare Gumdrop, who has already had a winner by the sire. The extended family includes Grade 3 winner Dixie Serenade, who is herself by Uptown Charlie Brown, so you know the sire works well with this family. Uptown Charlie Brown stands at Diamond Bee Farm in Pennsylvania, and has quickly become one of the state's top sires, with runners including recent Paige McKinney Handicap winner Wait For It.
So you kind of touched off on this, Dr. Papp, but one of the things that I'm seeing people ask a lot is like, what possible impact could this drug have had on performance? So like, what does it do in the short term, like in the days after you inject it, and then kind of how does it continue acting in the longer term on a horse's body?
Sure. So we all know that racehorses try hard. They have a hard life. They do things that maybe they're not naturally designed to do. They have smaller legs, smaller bones, all that, and their joints are sensitive, and we're asking them to work hard on different surfaces. So it's not uncommon for a horse to develop what we call synovitis, which is just inflammation of the synovium, the joint capsule. Let's say you come in one day, the horse could have knocked himself in the stall, rolling around, knocked himself on the door, and his knees all swollen. He could have stepped in a hole while, trotting down the road, something like that, and just tweaked it a little bit. And so if there's inflammation in there, you go to squeeze around there, the horse is like, ouch, that hurts. And they may limp if it's significant enough. And the fluid development, actually, like raised trigger finger stuff, when there's fluid on something, it will decrease the range of motion. It'll cause fibrin. There's all sorts of inflammatory mediators that are bad and cause pain. And then with that staying in there, it'll cause permanent damage. So we usually x-ray, do some sort of diagnostic to see if the horse has anything more serious going on. But if it's just inflammation, we want to get that inflamed fluid out and replace it and calm down that whole cycle of damage from the inflammation. So if I was limping because I tweaked my ankle, or a horse did walking to, whatever, up to the track or walking back or just jumping around in the round pen, then after they show that there's no damage, but they are still limping, they inject them with a corticosteroid, one such as betamethasone. There's multiple others, sometimes some new lubricating fluid as a replacement. And then the horse, usually a maximum effect is about 3 to 5 days. And they will feel tons better. tons better. And then that can it could last for months if it was just a mild case. Or if there is something underlying there, let's say there's a defect in the cartilage about to be a chip fracture, you can hide that. It'll feel great for about, like I said, 5 days maximum effect. So maybe 12, 14, 21 days. But after that, they're going to be really lame when it wears off.
Why is it that many of the state regulators have extended the withdrawal guidelines for corticosteroids? It used to be, it might have been 72 hours, then it went to a week, and now a lot of jurisdictions are at 2 weeks. Why is it pushed out that far?
Because people were taking sore horses and injecting their joints to make them perform better. I mean, that's as simple as it is. I mean, realistically, if you read from the harness world, they've made lots of posts. They say, well, we race every week. There's lots of inflammation. We need to inject our horses' joints to keep them healthy. But at the same time, it also has the ability to mask things. So without the proper diagnostics being done, there is a huge danger of doing more harm than good using corticosteroids in a sore horse.
So one of the things that people are also sort of starting to ask, assuming that the split sample comes back positive, and, you know, if you're going to nod along with the story that this betamethasone got in there due to treatment for a skin issue, what is your sort of take on why should a trainer or an owner in the situation be penalized for treating a skin issue, if that's really, you know, what happened here?
Because we have a responsibility to know what is being applied to, given to, fed to, done to the horses in our charge. That is a trainer's job. That's a veterinarian's job. A lot of the owner delegation is to the trainer. That's what they pay them for. That is what they trust them to do, is to properly manage all of the components of taking care of a racehorse. And applying ointments, especially ones that are prescription drugs, falls into that category. I mean, we have liniments you have to look through. I can't remember how many years ago, but one of the poultices contained lobelia, and they were getting a lot of positives for that. And so things change, and we need to be aware of these as trainers and owners. And I've heard so many times from many trainers, we run such a tight ship here, and we are very careful with, you know, everything that we touch and use and do, and every groom wears gloves, this, that, and the other thing. However, something as simple and basic as an ointment, a liniment, medication for skin, antibiotic, all of those things are actually supposed to currently now being written down in a trainer's log to be read at any time by a regulator. That's what, at least in Pennsylvania now, we're supposed to be doing, and a lot of other states have followed suit. So, you know, if you're believing that the penalty should just be as if you were cheating in any other way, if you want to call it cheating, you're breaking the rules, is basically what it comes down to. So you should be treated as such. Whatever the rule is, you should be subject to what it calls for.
Are we missing anything with this? Is there anything? Do you have any opinions or thoughts on this that we haven't touched on in this brief conversation here?
I do believe that in Otamax that the betamethasone is specifically betamethasone valerate, and in the injectable betamethasone, it's acetate and sodium phosphate. So my guess would be that there is a test to determine if actually there is a difference, and if one is present. Also, there were 3 active ingredients in Otamax, so therefore those active ingredients should also be present. Or at least you could even take a swab from the skin to prove that that had been being applied for such a period of time. So I do think there's ways of kind of hashing this out.
Were you surprised that, would you be surprised that you could get a positive test from the Otamax?
Yes, I would be, unless the horse was licking it constantly over and over again and drinking bottles of it. Yeah, I am surprised if it's Otamax that the horse is testing positive from. There's no obvious wounds, deep wounds in the horse where there's blood vessels able to absorb these things. And it's in an oily base. So it's not like it's something super easily absorbed into a horse's system through intact skin.
Natalie, do you have any other follow-ups
I think that one thing that I imagine like the mainstream public may have questions about, first they were told, we haven't given the horse the drug. Don't worry, we didn't inject the horse with anything because he doesn't have sore joints. And then they were told, well, he doesn't, but he does have this skin condition that needed an anti-inflammatory to make him feel better. As a horse person, I have a sense for a horse can work with some degree of a skin problem as long as it's not being aggravated by the work. But can you kind of like put into context for non-horse people, like, is it okay to be working a horse that has a skin condition such as the one that we've seen pictures of?
The one that we've seen pictures of, in the first few days, like Ray had mentioned, this has supposedly been going on since the Santa Anita Derby, and we are not limited. We have many options for treatments of skin diseases. We can actually take cultures by just swabbing the area and sending it to a lab and say, hey, what's causing this dermatitis and how deep and severe is it? And then the lab comes back and says, hey, this medication will treat it, no problem. So there's lots of options that didn't have to be Otamax. So there's one thing if you want something soothing versus non, there's nothing wrong with putting some Vaseline on and something you want to protect from getting dirt into it. There's nothing wrong with using triple antibiotic ointment that we can get over the counter, eczema cream, aloe, things like that, all soothing and helpful. If it was spreading, then I'd probably do some blood work or, like I said, more extensive testing to find out what we need to treat this dermatitis with. But it's important that this horse was affected in his hindquarters pretty superficially from what I can tell from the pictures. If it were in a girth area, and I've seen this happen where the girths rub and cause a burn and the burn becomes very infected, especially in gray horses, things like that, or underneath their shoulders where they reach out and get a lot of friction rubs. And those areas can especially, or even on the sides of their mouth, you'll see some wounds by where the bits pull. And those things definitely need treating because it's painful. It's not humane not to medicate them. But in this area and for that length of time, there were other options. And I don't see why anyone would risk using the same product for such a long period of time when there's multiple ways of figuring out a better way to do it.
Well, Dr. Papp, this has been fascinating. Really do appreciate it. Really appreciate your expertise. And once again, thank you for the work you do in aftercare. It's an important part of our industry these days.
Well, I'm hoping that everything will just kind of fix itself. I'm really looking forward to HISA, and hopefully we won't have to have so many aftercare programs, or that, more people will jump up and be a part of it. I know they say no press is bad press, but maybe people will be like, I need one of those thoroughbreds, they look pretty cool. So we'll see how it goes.
All right. Well, thanks again. And now we're going to take a quick break for a toast to Vino Rosso.
Hey gang, it's Bloodstock editor Joe Nevels here with your toast to Vino Rosso. This time around, we're going to Mulholland Springs Farm in Lexington, Kentucky to visit a colt out of the To Honor and Serve mare Call to Service. This February 16th foal was bred in New York by the partnership of Sequel Thoroughbreds, Lackland Farm, and Mark Toothaker, and the dam is a half-sister to Grade 2 winner Isotherm. This foal is being boarded for clients, but Martha Jane Mulholland of Mulholland Springs said she's got several Vino Rossos of her own, and the consistency was really impressing her. She said you could just count on them being very substantial, viable, good-looking foals. If you can't get excited about a foal at this stage, it's a long walk back to get excited for when they sell and race. Just like so many other things with this stallion, so far, so good. And that's our toast to Vino Rosso.
Thanks to Joe Nevels. Thanks to Spendthrift Farm for their sponsorship of A Toast to Vino Rosso. Fascinating conversation with Dr. Papp. Don't you think so, Natalie?
Absolutely. It's always very informative to listen to her. And she, you know, as she says, does a lot of research whenever there's a particular topic up in the news. And so I learn all the more from her because she's learning about it as she goes. So that's just great.
Saturday's Preakness Stakes card, 14 races, first post 10:30. There's 10 stakes races on the card. The last race of the day, the last stakes race of the day is the richest North American race for Arabians. It's the $100,000 President Cup presented by the Arabian Jockey Club. Check out this video for that race.
Paddy's Day in Central Time.
After the UAE President Cup went down to the wire at the Preakness in 2020, the richest Arabian horse race in America returns to Pimlico in 2021. Since 1994, the oldest global series of Arabian horse races has hosted races on some of the sport's biggest stages in the United States and around the world. The UAE President Cup in the USA features one of the strongest fields in American history. There are 3 horses of the year: Paddy's Day, Quicksand AA, and Uptown Sandy Girl. Paddy has won the UAE President Cup twice. Quicksand is also a former winner of the race. Sandy is the reigning horse of the year, and hoping third time is the charm in the UAE President Cup. Half the field of 12 have won Darley Awards. The Arabian Jockey Club Facebook page will feature coverage of the UAE President Cup from the Preakness. We hope you enjoy the star-studded race that puts the spotlight on the majestic Arabian breed and brings cultures from around the world together.